The focus of the prevention pillar is to prevent the onset of substance abuse, to block problems before they occur. In addition to education, prevention requires collaborative strengthening of the health, social, and economic factors that can reduce the risk of substance abuse. Those factors include access to health care, education initiatives, and support within places of employment. I'd like to introduce our next speaker tonight, Kelly Rowe. Kelly is in her 8th year as a social worker at Preble High School. She's one of the department chairs for the Green Bay Area School District Social Work Department and is also the AODA coordinator for the district. Let's welcome Kelly.
The average age of the first time a child uses marijuana in the age of Wisconsin is age 14, which coincidentally also is about the same age they enter high school. When we see students start to experiment with alcohol and drugs, they're setting off their high school career on a very dangerous ground. 71% of high school students perceive there's no risk to smoking marijuana once a month. And a common misconception amongst high school students is that marijuana is not addictive. Marijuana is extremely emotionally and mentally addictive. An example of a high school student that I will give you, someone that I know, beautiful young lady, began smoking marijuana at the end of her sophomore year. Prior to, you could see decent grades, involvement in activities, attendance was near perfect. Unfortunately, looking at her grades and attendance, I could almost literally draw a line to see where the alcohol and then the drug use began. When you talk to them about what the problem is, oftentimes what you hear is, it helps me relax, it's no big deal. Unfortunately, when you point that out to them, those concerns, it's a very real reality to say, look what this is doing to you. But that right there is the power of addiction. Another thing that we see is oftentimes the occasional usage becomes something regular, often as a way to escape. The good friends start to distance themselves because they see you as someone who's a user. They see you as someone who's more into smoking or more into drinking or more into drugs than the other things that your old good friends are into. When that happens, you become more integrated with a group of friends who smoke or drink or do drugs. And those become your friends, your so-called friends. The people who are there for you when you want to get high or there for you when you want to drink. But what we find is when students, if they come to the reality that they would like to quit drinking, smoking, possibly quit skipping school and start attending, those friends, those new friends are no longer there. And that is a very, very, very challenging situation to be in, and I see it all the time. They're lost. They have no one to turn to. Their old friends don't want to be there. They don't want to be around them because they see them as a drug user or a drinker, and that's not an image they want. But their smoking and drug user friends don't want to be around them either because they're no fun anymore, because they don't want to support that habit. That is very challenging, and we do what we can in schools to try to be there for those students, but it is an uphill battle, and oftentimes we see they can't do it alone. We try to do as much early intervention as possible. Oftentimes when we see students receive policy violations, if they're caught with having an alcohol beverage or a drug on them at school, or they are at school under the influence, there is a process and procedure that is followed. The parent is met with, as well as the administrator and the social worker, and there is a process in which that student is required to complete a screener where they are talked to and information is provided to that parent. As a result of this heroin epidemic, this year we are also integrating into all health classes, 8th and 9th grade, in an effort to reach as many students as possible, a full class period heroin education piece, where we talk about how exactly what we're talking about tonight, that it does not start with heroin, and that slippery slope that we've all become too familiar with. We also recognize, just like with Amalia, that it is not always the kids that you think of as troublemakers. It's very often the students that you see as really good kids. And so we want to reach out to clubs, activities, and sports in an effort to educate students and their families about this terrible, terrible epidemic. Thank you very much.